Hi guys, this is Lily here at Aspiring NP. Just wanted to check in today to see how everybody was doing. I haven't been able to go on live or upload a video in the last week since I've been gone for Pri-Med East conference about a week and a half ago and have pretty much been dealing with a lot of stuff since. So today's topic I wanted to, actually was brought to my attention. People wanted to know a little bit more about the differences between the specialties of nurse practitioners and how a person can make a decision of which type of specialty they want to commit themselves before going to school, or perhaps if you're considering a postmaster's certificate, etc. Well, I'm a family nurse practitioner myself, as you all know, and that really has allowed me the flexibility of working with multiple populations. So for instance, I have worked with adolescents, kids anywhere from the age of 12 and up. I have worked in a clinic that sees all ranges, so I sometimes was doing newborn visits or 2-week visits of little children that, following up their birth. I was doing gynecological visits at this clinic and other follow-ups of chronic care disease, all the way ranging to geriatrics, which is actually what I'm doing right now. My current job is mostly 65 years old and older adults, and I conduct home visits in their home. So I find that for me, at the time where I wanted to become a nurse practitioner and was considering starting school, I didn't really know specifically what I wanted to do. I knew that I liked a lot school-based health centers and school nursing, because I had done school nursing for the previous year, but I didn't want to, tie myself down to one specialty. So what I ended up doing, I shadowed my father, who at the time was a psychiatric nurse, who was helping a psychiatrist at a community care clinic. So I shadowed him for a full day to kind of get a sense. I shadowed him and the psychiatrist to kind of get a sense of if a mental health nurse practitioner would be something that I wanted to pursue, since that was what he was actually doing at the time. My dad was in NP school at the same time that I was. We were about a year apart when we graduated, and he kind of wanted to encourage me to pursue that route. But after spending a day with him and with his psychiatrist that was supervising him, I didn't really like like to do that full time. Like I came home very drained to tell you the truth, and I found that perhaps I needed something more diverse, because at least the population where he was dealing with at the time was very they had a lot of traumas, and they would freely talk about their traumas, and I guess I hadn't developed, and I may not have developed yet, I'm not sure, the coping mechanisms to kind of separate what you hear during clinicals or during your work day and not bring it home. So I left that day from that clinic feeling really heavy and just really unhappy, and just after all I had heard from like the 16 plus people that came and went. So I just wanted to kind of talk about that experience. So that's how I ruled out that I did not want to become a psychiatrist, a mental health provider, a nurse practitioner. And then the other possibility, which was also something I was considering at the time, was becoming a certified registered nurse anesthetist, which is a totally different ballgame. I mean, this is like in a surgery room. You're under, the patient's life depends on you. You're part of a multidisciplinary team. You are working alongside OR nurses and surgeons, and it's very specific type of job to a specific type of setting, which I also found a way to shadow a CRNA, and felt very stressed while doing that. So I kind of felt like that may not be what I wanted to do for the rest of my life as well. So that's how I kind of gathered that family nurse practitioner was a broad enough field for me to go into, since I didn't really have a specific idea of what I wanted to pursue. So I suggest that if you're wavering between specialties, you don't really know which one to pick, it might be easier to do an adult nurse practitioner program, just because the clinical hours are only going to be focused on adult settings. So you may have an easier time finding a preceptor that is in internal medicine or that doesn't see children, because seeing kids and seeing the OBGYN side to complete your family nurse practitioner requirements is definitely something that took the longest to find, a placement for a site, because I needed to go to somewhere else to do the pediatric side and somewhere else to do the nurse, the OBGYN hours. So adult family nurse or adult nurse practitioner, you don't have, as an adult nurse practitioner student, you don't have to worry about that. You pretty much will complete the bulk of your hours, when dealing with people ages, I think it's 14 and up, or maybe 16 and up. So that's most family or internal care practices will be able to accommodate all of your clinical needs and hours. So I had a friend who is an adult nurse practitioner, and that's one of the reasons why she chose it, and she told me so. At the time where I was becoming a nurse practitioner, adult nurse practitioner, wasn't as popular as it is now. So I don't think my school, Frontier Nursing University, was even offering it. I think the options were you became a certified nurse midwife, you became a family nurse practitioner, or you could become a women's health nurse practitioner. Women's health nurse practitioner is a very narrow field that obviously if you've worked in women's health and you're very passionate about that area and it's very specific to it, that may be something that you can do, but you probably won't be hired to do anything else outside of women's health, OBGYN offices, and preventative care, pregnancy and fertility clinics, those kinds of things. And as gerontology nurse practitioners, that may be a growing field, because we now have the baby boomers all aging, and the need for older adults and care for the older adult generation is increasing, and it's only projected to increase. I think it's through 2020 or 2024, something like that I saw. So that is a growing field. So in fact, even though I'm a family nurse practitioner, that is the area that I work in right now, because that's the area that accommodates my schedule in order to serve my babysitting needs and give me the flexibility that I need at this stage of my life. I would not be able to do an office work and be away for large chunks of times, Monday through Friday, or even Monday through Thursday, and miss out on a lot of the things that I want to be there for my toddler. So that is something that it's definitely something to consider, and I would urge you to do your research and to make sure that you see a lot of job openings for your area. But if you're not sure and you don't know where to begin, there is another video that I made earlier which talked about 5 things to consider before you consider becoming a nurse practitioner or starting nurse practitioner school. So that might be something that you can look at or check out in addition to this video. But I just wanted to quickly give an overview over how I made the decision of becoming a family nurse practitioner versus any other specialty. I hope it was helpful. Thank you so much for tuning in, and please leave your reviews and comments. I would love to hear from you. Have a great day. Take care.